Over 120 beds to cater for dementia patients are now available both at the John Mackintosh Home and Hillside. This latest additional capacity of 18 beds on the ground floor of the former St Bernard's Hospital was opened today after conversion works to the former assisted living flats.
Housing needs and assisted living needs are certainly aspects of the housing strategy which my colleague will be able to tell you about, but this is not as a result of an oversight. It is just that we realised that notwithstanding the additional capacity that we introduced with Hillsides, persons living with dementia in our community were increasing, and we came to the view that the additional capacity of 18 beds would in fact be sufficient at this point in time to meet the needs of the community and indeed for some years to come.
I'm very satisfied with the way that our government has evolved in terms of providing for elderly needs, both in residential services and in the community. What we've done for elderly people and people with dementia really is unprecedented. In terms of admissions, that's a clinical matrix that's applied, and there's a team of clinical professionals who will assess individuals, and they will decide who will be the priority in terms of admission.
You highlight the work done by the elderly residential services, describing them as angels of care. But how much of an investment is made into the provision of care provided?
Particularly for the elderly in our community and for people with dementia, is an absolute priority for our government. We've demonstrated it over the last 6 years with the addition of numerous facilities and the way that we deal with everyone at a professional level, at a clinical level, and in terms of the facilities. For us, it's incredibly important.
And what type of impact is this expected to have? Will beds at St Bernard's Hospital be released?
Hopefully there will be some beds released at St Bernard's Hospital, which will mean, of course, that we will have increased bed capacity for acute admissions and also to be able to plan advanced surgeries.
Well, these are now dementia-friendly facilities, but what's exactly in place to cater for these patients?
You will see the low-level beds, you will see the colour coding, you will see specifically constructed hoists and other mechanisms, and everything, all the furniture and the signage, all of it is geared towards making the sensory experience for people living with dementia as friendly as possible in order to reduce their anxiety level.
The Alzheimer and Dementia Society has welcomed the refurbishment, but the group's Daphne Alcantara says dementia is a worldwide problem that's on the increase and one that needs to be planned for.
Here in Gibraltar, what we find is that the rates are really going up, and Gibraltar being a caring community, we find that most people want to have their loved ones at home for as long as possible. So I think that the way forward with us at the moment is that we need more respite beds. And that is certainly going to help lots of families in Gibraltar. If we don't start doing this now, I think that in 15-20 years' time, we will find that they will never have enough beds to deal with the actual problem that is already arising.
This latest initiative aims to provide further modern purpose-built homes to better suit the needs of elderly patients.